we're in now, in case anybody's trying to join. You're able to see the meeting ID, and that's the one ending in 4857 from Christina.
Great, thanks, Christina. Well, good afternoon, everyone. It is 4 o'clock. My name is Susan Harden, and I'll be facilitating this afternoon's meeting of the Community Advisory Committee. This is actually, I believe, is it our 15th or 16th meeting? I thought it might have been number 16. But Christina, maybe you could verify.
Correct. It's meeting 16.
Meeting 16. So that slide is wrong. So just don't worry about that. But it is the meeting 16. So welcome, everybody. We're happy that we have members of the Community Advisory Committee, members of DPH staff, members of the public all here this afternoon. Just as a note to me not familiar with the CAG, the Advisory Committee was set up at the beginning of this process as a way to provide input into the process and into the results of the health research study. So again, we just thank you everyone for being here this afternoon. Just a couple notes on meeting structure. For 2021, we have switched to Zoom, which seems to be more comfortable for most community members, and most of us are using that pretty regularly throughout COVID. So we have switched to that format, and we envision using Zoom for the remainder of the meetings this year. Also, just a difference from our last meeting, we will have a short presentation from DPH on the health study timeline and status, along with just a brief intro to the goals and priorities document. And then all of the CAG members will be unmuted, and we're going to have an open dialogue and conversation and receive input from you all in that manner. We do ask, though, that we still use raise hand function and chat to acknowledge when you want to speak, and try not to speak over each other. We are going to do kind of a round robin discussion when we get to that goals and priorities discussion, but definitely want to leave everyone unmuted during that discussion, which will be about between 4:30 to 5:30, and then we'll have an open conversation again in a Q&A format. Also, a note on meeting structure is that in the early stages of COVID, I believe it was last May, that we started meeting at 4 o'clock. And we adjusted that time frame in part because people were mostly home at that time, and it was a very unsure time frame, and people were a little bit more comfortable meeting earlier in the day. It's become noticed recently that people they're not as comfortable, that there's a majority of CAG members and some public members that would prefer to have the meetings later into the day and into the evening. So we will be moving the meetings to either a 5 or a 6 p.m. start time. And we are asking CAG members if you wouldn't mind posting into the chat whether you have a preference for 5 or 6 p.m. and we'll be able to make that change to all the agendas going forward for the rest of this year. So either a 5 p.m. or a 6 p.m. start time will work, and then we'll make the adjustment to the website, and if we can actually count out the preferences from the chat, and we'll be able to make that announced to everybody in the meeting tonight as well. So those are a few meeting structure items. Christine, I will ask if you don't mind to announce those CAG members that are here in attendance. But before you do that, I do want to welcome Don Dwiggins, who is the most recent addition to the Community Advisory Committee. He is replacing Mike Kaiser from the Northridge East Neighborhood Council. We certainly appreciate everything that Mike contributed over the last year and a half, and we really look forward, Don, to your participation. Christina Vega will be reaching out to you shortly just to make sure that you have all the materials that you need, and see if you have any questions or orientation that might be needed for you as well, but certainly welcome you to the group. And so with that, Christine, if you don't mind announcing all the folks that are on the committee.
Sure.
That are here.
Of course. So that are here today, I have so far Andrew Crone, Brian Allen, Don Wiggins, Craig Galante, Lori Ivizan, Mary Blair, Miran, and Patty. I do see that somebody with the phone number ending in 2212 is raising their hand since the beginning. So we could just unmute them to make sure if it's a CAG member, we could go ahead and identify them.
Sure. So I am trying to unmute. I said I'm trying to ask to unmute, but I don't know how you can ask someone to unmute if they're on the phone. There we go.
This is Glenn Bailey, Northridge. You've taken care of it by announcing Don Wiggins.
Okay, perfect.
Okay,
Thank you so much, Glenn.
Thank you. Thank you.
And I don't the phone numbers, if anyone else from the CAG is on that maybe has either listed by iPhone or some other pseudonym, if you could let us know, we'll make sure to change your number there too, or your name.
I see another hand raised for Maddox, so we want to just ask that person if they want to identify themselves. It might be.
Okay, I'm going to recognize Maddox to see if Maddox, you are a CAG representative.
Can you hear me?
Yes.
Hi, Heidi Tortorici.
Okay, are you a member of the public?
Public.
Okay, great, thank you.
All right, well,
Okay.
those are all the members that I have. If there's anybody from the CAG who joins after, I'll keep an eye out.
Yeah, we'll keep monitoring that and make sure we have an accurate representation of the committee members that are here. And without further ado, I will turn it over to Christina to give a short presentation on the health study timeline and the health study goals and priorities. Again, those are our two key objectives this evening. Is a fairly short, concise agenda before we get to Q&A, is just to give you that update, provide you with the background on the health priorities and goals document, along with how the public can provide input as well, and then to receive some focused input from the CAG members.
Hey everyone, can you hear me?
Yes.
Okay, perfect. Okay, so what you see in front of you is an overview of the timeline. I'm hearing a little bit of an echo, do you?
No,
You sound
you're
good.
fine, Chris.
Okay, good. Okay, so I just want to give a little bit of an overview before we get into the goals and priorities and the meat of this meeting. So what you see here is a 4-phase diagram. So the first box on the left is the first phase of this health study. And what this is showing us is that the first phase of the health study was very much included community engagement and outreach. I'm sorry, I'm just hearing a little bit of an echo, so it's kind of distracting, but let me see if I can fix it quickly.
Yeah, sorry, Chris, it must just be on your side, because unless others hear a problem, I don't have any background.
Okay, test.
Sounds
Okay,
good.
that's much better. Yeah, sorry everyone. I was trying to talk over myself and that was kind of difficult. Okay, so back to the presentation. What you see here is a timeline of the health study, and the first phase is identifying health concerns. So what this phase involved was community engagement, extensive community engagement, and outreach to the community surrounding the Aliso Canyon gas storage facility. And this was done in a variety of ways, including open houses, providing updates and soliciting questions at neighborhood council meetings, hosting a virtual town hall to which the community was invited to ask questions about the health study, and also to hear about the disaster and the implications of that on community members. And then in addition to that, during this phase, we established, as you know, a community advisory group to serve as representatives of their respective neighborhood councils and also stakeholder groups. And during this phase as well, we worked extensively with this community advisory group on a variety of outreach and engagement efforts. Also, during this phase of the study, we established a body of renowned scientific experts composed of agency representatives and independent experts from a variety of institutions, academic institutions across the nation. And the Scientific Oversight Committee, as they're called, was established to oversee and guide this process throughout all of its phases, as you see here. So during this first phase of the health study, with the establishment of the Scientific Oversight Committee, Again, they're a group of scientific experts in the fields of epidemiology and disaster behavioral health and mental health, toxicology, community-based research and exposure assessment, as well as air monitoring and modeling. These experts are mandated by the consent decree, and they're responsible for determining the goals for this health study, as well as the areas of focus and the priorities. So based on community input that has been collected during this first phase of the health study, as well as discussions among the community advisory group and their expertise, they have put together a draft document that outlines the goals for this health study, as well as priority areas of focus. And this is what we're calling the goals and priorities document. And we'll get more into that later on in this meeting so that you're aware of what it is and what the opportunity is there. So back to this diagram, though I don't want to get too off topic. The second phase is the research solicitation phase of this health study. And this is the current phase that we're in now. So during this phase, we're going to be focusing on administering a competitive process to solicit research proposals from research groups across the nation who are interested in actually implementing this health study. So they're going to be third-party researchers who eventually actually conduct the research for this health study. So during this phase, the Scientific Oversight Committee is heavily involved in developing key components of this request for proposal, which is the process that has been chosen to solicit researchers. So the SOC has been having discussions over the past few months to develop this RFP. And the RFP, although it takes a little bit longer than everyone would like it to take, this process is an open process and allows for any interested researcher other than Scientific Oversight Committee members themselves to apply for funding from the settlement to actually conduct the research. So this is the research solicitation phase that we're currently in, highlighted in yellow. And then the next phase is the research phase. And this is the phase we're all waiting for the research to actually happen. And it will be conducted by third-party researchers who are awarded a contract after the RFP process is complete. So then the last phase here, just quickly, is an evaluation phase of this health study. So after the third year of the health study is complete, the Scientific Oversight Committee is mandated by the consent decree to conduct a evaluation of the health study itself to determine whether it's on track to meeting the goals that this Scientific Oversight Committee put together for this health study in advance. So this evaluation will happen at the end of the third year, and then it will happen on an annual basis after that third year. So this is kind of a high level overview here of the process, the timeline that we're currently in. And again, we're in the second phase of this project, the research solicitation phase.
Thanks, Chris, for the update. If you want to next move to the health study goals and priorities document review, then we can open it up for dialogue.
Oh, I did also have a few other updates. I think it's probably, yeah, sorry, everyone. Let me just grab a quick drink. Okay, so a few other updates for the group. The community opinion surveys is the first update. So just wanted to provide everyone a little bit of background on this community opinion survey. So for those who might not be aware and who are on the call from the public, last year, Public Health brought on a third-party survey research group called Probolsky Research. And they were brought on to conduct a community opinion survey. And the purpose of doing this was to gain a broader understanding of the community concerns, perceptions, and attitudes regarding the Aliso Canyon Blow Out and its impact on community health, the community priorities for this upcoming health study, and the community concerns. And this would be one of many avenues of input from the community to inform the health study goals. So this survey was again, one of many channels to provide input from the community. So Probolsky Research developed the survey questions with input from both public health and members of the community advisory group. The geographic sampling frame, meaning that the neighborhoods from which the survey respondents were identified, and the proportion of respondents surveyed from 3 geographic areas consisting of several neighborhoods was determined by members of the community advisory group. The survey sample was developed from consumer data and stratified randomly to ensure that there was a representative sample from the communities from which the survey respondents were being identified. So this survey was conducted over the phone and also online, and that was one of 2 surveys that was conducted. So actually another survey was also conducted, the same survey as before, but an online version only. And the purpose for doing this online version of the survey was the same as the first. So again, to gain a broader understanding of the community concerns, perceptions, and attitudes regarding the Aliso Canyon Blow Out and its impacts on health, and also community priorities for this health study to inform the health study goals. So both of these surveys offer important insights on the impacts of the disaster, and then also on the concerns of the populations that were impacted by this disaster. So the update here for the group is that these surveys have now been finalized, and the survey results have been confirmed by the Probolsky research team. And the surveys have been provided to the community advisory group that was involved in developing the survey. And the survey reports, 2 of them, will be posted on the Aliso Canyon Disaster Health Research Study website Thursday next week. So that's the community opinion survey update. And then I have another quick update on the oversight committee itself and the work that they're doing. Just give me one more second so I can grab a drink. Okay, so the Scientific Oversight Committee has been very busy over the past few months. And in addition to putting together the draft health study goals document, which we'll dive into a little more after this update, they've also been focusing attention on developing the key components of the request for proposal. So during the past several meetings, the Scientific Oversight Committee has really been thinking critically about what the goals of this health study are and the concerns of the community, and then have identified critical elements for the health study. So together, these conversations are really just informing and shaping the scope of this health study and other critical components of the RFP. So the SOC has met several times this past month, and we'll be meeting a few more times over the next few months to finalize that RFP, and they'll continue to provide their expertise and technical guidance in this RFP process. So that's the second update. And I guess now we can go and turn over to the health study goals and priorities.
Great, thanks, Chris.
Okay, so before we get into that, I'm going to see if I can share my screen. Okay, can people see the screen?
I think we still see the slides, and there, now I see it.
Okay, good. Now you can see it?
Yes.
Perfect. Okay, so now to dive in a little bit into the health study goals and priorities. So what you're seeing here is the Aliso Canyon Disaster Health Research Study website. This is the main page, and we have a banner that provides updates at the top. So the first update that you'll see here, the second update that you'll see here is the draft health study goals and priorities. And if you click on this banner, submit your comments here, you'll be taken to the health study goals and priorities. So it starts off with just a little bit of an overview of what this is. So this is a cover page to basically tell people, you know, this is what it is, this is what it's for, this is who developed it, how they developed it, and also ways to provide your comments and feedback. So right now we're accepting feedback either through email. You can email us at the Aliso study at ph.lacounty.gov. And then you can also provide your feedback through an online form. So all you have to do to access the online form is to click this link in the document that spells out online form. If you have any problems accessing that form, you can please just reach out to us via email or even over the chat in this meeting if you're trying to access it now, and we can help you troubleshoot that. So I'm going to get a little bit into an overview of this document. And then after the walkthrough of the document, I'll provide a little bit more information on why we need you to comment on this document and how this document was developed as well. Okay. I can actually make it bigger because this is probably really small for everyone. Okay, so the first section is just a background section. With any document like this, you need to provide a little bit of background information in case people aren't aware of what the health study is or what we're trying to accomplish with it and why we're doing this in the first place. So this background goes over the Aliso Canyon disaster, what happened during that time. I'm not going to get into all of the details listed here, but just want to give a brief overview of what each section of this document contains. So in addition to just giving a brief overview of the disaster, it talks a little bit about how the residents were impacted. So the symptoms that they experienced after and during this blowout, for example, the irritations to the eyes, nose, and throat, abdominal discomfort, headaches, migraines, dizziness, lightheadedness, nosebleeds. All of these symptoms were experienced both during and after the disaster. And this was determined by a community assessment for public health emergency response. So these are all symptoms that public health heard from the community, both during the disaster and after, and how these residents were impacted during that time. So this document also gets into a little bit of the history of how agencies responded to this disaster. For example, a direction to SoCalGas to expedite efforts to stop the blowout and also to relocate residents. So getting into, again, how residents were impacted by relocations. Both relocations of households, and I also want to mention of schools as well. So that can really impact people if they have to completely pick up and move out of their homes, out of the places where they're getting their education. It just completely is life disrupting. So this is the purpose for including this. Again, it gets into a little bit more about the response, the community assessment for public health emergency response, and as well as the investigation that was conducted after the blowout, which found trace elements of and combinations of metals in wipe samples. So just a little bit more background on this and how that provided information on potential exposures to members in the community that was impacted. Okay, this document also gets into a little bit about the settlement and how money was devoted to several supplemental environmental projects. So one of those is the health study that we're currently focused on. So money was devoted towards that, and public health will be administering the funds for this project, as well with working closely with the Scientific Oversight Committee in implementing this process. So After that, we get a little bit into some of the research that has been conducted to date, on disasters of this nature, and there really hasn't been a disaster of this scale and magnitude. The Aliso Canyon disaster was the largest blowout in U.S. history, so we really don't have a lot to build off of in terms of exposure to that magnitude and for that length. So this is what this section of the document kind of gets into, and also that there is research out there that gets into several of these oil and gas compounds we know to be harmful to health. So in addition to mentioning that, another large concern of this community, and as well as the Scientific Oversight Committee, is the impact of this disaster on both the mental and social and community health of the communities that were impacted. So there's a growing body of research on these areas of behavioral health, of disaster behavioral health on communities and networks. So this section gets into that body of, a little bit into that body of literature, the scientific research in this area. So lastly, there's a little bit of information here about if you're interested in exactly what a health study is. There's links here to fact sheets and also to a video on what a health study actually is, so that you can get a little bit more information on that. Okay, so this next section gets into the goals of this health study, and these have been put together by the Scientific Oversight Committee over the past almost a year, I guess, now that they've been put together. A lot of thought and energy has been put into developing these goals based on what the community concerns are, and also the scientific expertise in this group. So the overall goal here in bold is that the Aliso Canyon Disaster Health Research Study is to contribute to the understanding of the potential short and long-term physical, mental, community, and social health impacts of exposure to the Aliso Canyon disaster. So again, really focusing in on not just the physical impacts, but also those other impacts as well, such as mental, community, and social. And then getting into more specific goals here. The first one is to evaluate the relationship between exposures to air pollutants, chemicals, and other pollutants during and or following the disaster, and adverse health impacts of priority to the community, which could include but not limited to physical and mental health. So I just wanted to point out here that this specifies that this research can look at kind of an extended time frame if so not just during the disaster, the exposures that happened, but also following the disaster. The second goal here is that the Aliso Canyon Disaster Health Research Study will investigate the impacts of stressors related to the disaster on the quality of life and functioning of residents in the impacted communities, both during and following the disaster. So again, that extended time period, and then as well kind of taking a broader approach to what we're considering as potential exposures here. So stressors can include anything from, for example, changes in your social networks, changes in your in where you're living, changes in classrooms, changes that happen that can add stress to your life and it ultimately impact your health. So this is kind of taking a broader approach to studying the impacts of this disaster on the community. And lastly, this third bullet specifies that the study will include susceptible populations, such as children and older adults in the impacted communities, as well, of course, as the overall community that was impacted. So now getting into the priority areas of focus. So the first section here is on study outcomes. So there's 3 different timeframes where outcomes can occur and have been identified by the Scientific Oversight Committee. So the first are acute health impacts. And these can include, but are not limited to, kind of the symptoms that were experienced early on during this disaster and after the disaster as well. So, for example, worsening pre-existing conditions and those other symptoms that I mentioned earlier, such as mucous membrane irritations, headaches, migraines, gastrointestinal and cardiovascular and respiratory outcomes. So these are the acute health impacts that that can be studied during this health study. And I also wanted to mention that, you know, acute impacts can also be emotional and mental in nature. So in addition to experiencing those physical acute impacts, you can also experience additional stress and even psychological trauma from living through an environmental disaster of this nature. So secondly, intermediate term health impacts. So this is something that the Scientific Oversight Committee identified as important for this health study as well. So these can include impacts such as preterm births and reduced birth weight and possible harms to pregnant women and developing fetuses and to child development. So we've heard from the community on several and many occasions that they're very concerned about child health and child development. So this is ensuring that there's a focus on that. And finally, the third time period, of course, that can be studied with a health study of this nature is chronic health impacts. So what are those long-term health impacts that could potentially result out of a disaster of this nature? So in addition to various concerns raised by the community, the Scientific Oversight Committee thought about this as well. And of course, this isn't an extensive list of chronic impacts, but they include those that the community has raised as concerns. So these include cancers, lung disease, psychological and mental health conditions, immune system function, just to name a few here. Okay, so the next section here kind of gets into kind of the social, behavioral, community, and community resilience aspects of health that can also be studied as part of this health study and have been identified by Scientific Oversight Committee members as important areas of focus as well. So this section kind of provides definitions for what those are, what they include. So briefly, I'll go over them. So social health is the ability to interact and form meaningful relationships and support networks with others. And relationships are especially important during stressful, traumatic situations such as environmental disasters. So this is one area of focus that has been definitely identified as priority. Behavioral health kind of gets into the connection between behaviors and also health, physical health and well-being, as well as mental health and well-being. So behaviors such as eating habits and substance use and exercise can all affect your physical and mental health. Next up is community health. So again, this is kind of taking a broader approach to how we identify and define health. So health of the community includes overall health status and functioning of a defined group of people. And also, you know, their characteristics and what is done to promote and protect and preserve health in the community. And finally, community resilience is another area that's been identified as important. So this kind of gets into, again, just going over the definition here, the sustainability of communities to withstand, adapt to, and recover from adversity. So community resilience is important in environmental disaster situations like this. So studying resilience is also important, an important area of focus that has been identified. So next, as I've been discussing, this health study can take a very kind of broad approach to how we're defining health. So in addition to physical and mental health, we're identifying these other factors. And as you can kind of get a sense here, is that there are a lot of influencing factors on health. And it's not just at the individual level. Yes, your individual health impacts, for example, your individual makeup can impact your health. But there are other factors, both in your social network, in the community you live in, for example, the governmental structure that can influence your health. So the next part of this this document kind of gets into that. So it mentions the socio-ecological model, which is a model that the CDC developed to kind of capture this. So here's a schematic diagram that represents all of these different levels of influence on health. And research can take a socio-ecological approach to ensure that each of these levels are being considered when ultimately studying impacts on health. So this is what this diagram in that section is kind of getting into. The next section here is study populations. So we've heard a lot from community members about who they're concerned about in their community. So susceptible populations have been identified by the Scientific Oversight Committee as being of concern. So susceptible populations of concern to the community include older adults, children, newborns, pregnant women, lower income individuals, minorities, workers, and people with pre-existing conditions. So we're identifying here that these susceptible populations are important to include in this health study, as well as the general population. And in addition to that, we've heard as well repeatedly from the community that they're also concerned about the health of their pets, and their pets are part of their families. So we've also made mention of that here.
So Chris, if I could just have you get close to wrapping up so we can open up for conversation, that would be great.
Yeah, let me work through this a little quicker. Sorry. Okay, so just a few more sections here. So study exposures. Again, we're taking a pretty broad approach to how we're defining this. So quickly, we're defining exposures as chemicals released during the Aliso Canyon Blow Out, as well as control attempts and potential exposures to chemicals released as part of ongoing, current, and regular operations at the Aliso Canyon gas storage facility. And exposures to social and other stressors arising from an environmental disaster situation and remediation efforts. So I just wanted to point out here, we've heard from the community time and again that they are concerned about not just that acute impact, that acute exposure that happened during the blowout, but also the potential chronic exposures that are happening. So we're highlighting here that in addition to exposures to chemicals released during that blowout, also as well during the current and regular operations. So this kind of gets into a little bit about what these chemical exposures could include, as well as what those other social stressors can include. So as I was kind of discussing earlier when talking about the outcomes, social stressors can include anything from changes in home and school environments, social networks, socioeconomic status, activity levels. So all of this is important to include when taking a holistic approach at studying health outcomes. Next up is data sources and collections. So the purpose of this is to kind of give an overview of all of the different methods and areas where data can be attained for this health study. So it kind of gets into primary data and secondary data sources. Primary data refers to data gathered by researchers specifically for the research that they're going to conduct. So these can include, researchers can actually develop tools tailored specifically for their research. For example, psychometric tools, which can be used to collect high quality data. So this is one form of data that can be collected, primary data. And then secondary data kind of gets into the data that already exists. So data that can be collected by government institutions, healthcare facilities, nonprofits, religious groups, recreational, social, and cultural organizations, et cetera. And this data is collected as part of their record keeping and may or may not be specific to the researcher's needs. So this kind of gets into a wealth of other information that exists as part of that can be used as part of this health study. So a few examples are given here on what that sort of data can entail. And finally, a little bit of information on proxies. So at times, proxies are used to actually measure either exposures or outcomes. For example, I guess one good example is socioeconomic status. So oftentimes that you can't really study that directly. So you can study, for example, income or education or area of residence, and that kind of gets at socioeconomic status. So that's just one common example of a proxy that's used in research. Lastly, a study type. So this kind of gets into the fact that this health study can be composed of various different projects, not just one. And these projects can consist of various different health study types. For example, population-based studies, clinical studies, record-based epidemiology studies. So various different research can be conducted as part of this overall health study. And that, as part of this request for proposal process, the researchers who actually submit proposals will be proposing how they're going to be conducting the research. So how they're going to be doing it, what are the methodologies that they're going to use, and that is going to be ultimately in the proposals that are submitted when we release this request for proposal. So that takes us to the end of this document. So Susan, I did want to briefly go over, if I have time.
We're a little bit over in terms of making sure that we get some good input from the committee. Is it something that we can add in after we get some initial input, or is it something really?
Yeah. How about we get some input from the community, and then we can circle back
committee.
if we have time.
Sure. So just thank you very much for that very thorough overview of the goals and priorities document. I know the CAG members probably had already read it, at least perused it before the meeting, since that was a big part of our agenda today. Hopefully community members, that wasn't too intense for you if you haven't taken a look, but hopefully it'll give you a good overview. So when you go back to review it, it'll help you when you do provide input via the survey or later into this meeting. We are going to unmute all of the CAG members. So we have 9 CAG members here. We'd like to make sure that we hear from each one of you as we get your input on specifically on this goals and priorities document. Emma, if you could help me I'll be asking you to unmute. Just a note that if you accidentally mute yourself again after you were talking, you just have to let us know and we'll make sure to get you unmuted as well. I'm trying to get to everybody, asking you to unmute. And if you'd like to either raise your hand or wave me down or put in the chat if you'd like to start providing your comments. And we'll just first make sure that we get a chance to hear from everybody, and then we'll open it up for open dialogue as well. Any CAG member? Oh, Don, there we go.
That's what it was. Okay.
Would any of the CAG members like to provide the first bit of input?
Is Mary unmuted?
Mary's unmuted, yes.
Okay.
Or
Still says
she was-
muted.
I've
Mary
clicked the
would like,
asked unmute.
Mary would like
There you
to. Now we're getting nasty echo here.
Sorry. I can go.
Yes.
Still my opinion that the Department of Public Health is acting with willful negligence, damaging the health of the community by failing to obtain and properly investigate the chemical list of all operations and full constituents of the gases, liquids, and solids from the blowout. And Supervisor Barger let the entire CAG know in a meeting with her that she agreed that the full disclosure needed to be obtained, and she was in full agreement of getting the chemical list. It was promised to the community multiple times over the past 2 years, and to date, there's no progress on this when the Department of Health has full subpoena power to compel it. So without full and complete what goes through, I have no confidence in that health study path or the stated goals and priorities.
Thanks, Mary. We continue to hear from the committee members, and then we'll have, I believe Dr. Davis might be on, so we can have him respond to a couple of these. If not, Charlene.
Susan, may I go?
Andrew, sure.
Okay, so my name is Andrew Crown, and I'm a victim of the Aliso Canyon gas blowout that exposed me and my loved ones to numerous toxins, including potential radiation. It is my opinion that the Department of Public Health has acted with willful negligence, further damaging our health by the following failings: the lie about acrolein, rationalizing its dangerous levels in 96% of homes and 5 of 6 schools tested, all of which were vacant, citing it was from cooking oils. Failing to disclose that benzene dust testing was not in fact done, yet claiming it was, and that the levels were safe. Lying about knowledge of the presence of toxic crude oil and failing to warn the public of that presence, and failing to do any due diligence analysis of the toxic constituents of the particulate matter. Therefore, for these and many other reasons, I have no confidence in DPH's current health study path, nor in the goals and priorities document. Thank you.
Thanks, Andrew. Any other committee members? Would you like to speak? Moran, are you raising your hand? So I just asked you to unmute there. Should have worked. You look like you're unmuted, Moran. If you try to talk, we should be able to hear
me
you.
now?
Yes.
Yeah. Okay, excellent. I just wanted to take this moment, and my name is Miran Kalajian, and I would like to read a statement from fellow CAG member Jeff Hammond, who could not attend today's meeting. My name is Jeff Hammond, and I am a victim of the Aliso Canyon gas blowout that exposed me and my loved ones to numerous toxins, including potential radiation. It's my opinion that the Department of Public Health acted without willful negligence, further damaging our health by during the blowout. Fourthly, advised firefighters and first responders all was safe when it was not safe. There was, for this and many other reasons, I have no confidence in DPH's current health study path, nor in the goals and priorities document. Thank you.
Thanks, Moran. Patty, I see that.
I'd like to go. I'd like
Craig?
to go next. Yeah,
Okay.
thank you, Susan. For those of you who don't know me, my name is Craig Galante. I am also a victim of the Aliso Canyon gas blowout that exposed me and my loved ones to numerous toxins, including potential radiation. It is in my opinion that the Department of Public Health has acted with willful negligence, further damaging our health by failing to properly investigate a cancer research study, as the current proposed methodology would be a false study that will not answer the community's health concerns if living near Aliso Canyon is just as safe as living away from gas and oil facilities. Also, DPH has failed to follow up on initial complete blood count, or CBC study, which indicated a long history of health harms to the community closest to Aliso Canyon. Therefore, for these reasons and many others,
I have no confidence in DPH's current health study path, nor in the goals and priorities document. Thank you.
Patty, you're up next.
Okay. My name is Patty Glick. I am a victim of the Aliso Canyon gas blowout that exposed my loved ones and me to numerous toxins, including potential radiation. It is my opinion that the Department of Public Health acted with willful negligence, further damaging our health by failing to properly investigate heavy metal poisoning and fugitive emissions in light of the identification by the GIS health study in 2016. Therefore, for these reasons and what my fellow CAG members are saying, I have no confidence in DPH's current health study path, nor in the goals and priorities document. Thank you.
Thanks, Patty. Brian?
I too have a comment here. I am Brian Allen. I am a victim of the Aliso Canyon gas blowout that exposed me, my loved ones, and pets to numerous dangerous toxins, including exposure to inhaling radiation. Because I believe the Los Angeles County Department of Public Health willfully acted with negligence, further damaging our health by failing to investigate the Aliso blowout with any sense of urgency, as well as intentionally leaving out a requirement to perform patient-centric long-range clinical studies from the goals and procedures document. Along with many other negligent actions, I have no confidence in the current proposed health study path or the goals and priorities document, and would like to know why.
Thanks, Brian. We have 3 members we still haven't heard anything from. Have Dawn, Melissa, and Lori. Lori, you're still on. I know. Did we lose? Oh, there's Lori. Lori, would you like to make any comments?
No, I'm good. Thank you.
Thank you. Melissa, any comments from you? We're definitely looking for some comments on this goals and priorities draft as well. If there's improvements that you think should be made, that's definitely something. Particularly, you can see the links on the screen there. We would love some additional input into this document. This is the document that will guide the RFP development, so it would be great to get some additional input into that. Melissa,
Susan.
oh, sorry. There we go, Melissa. I'm seeing she was unable to unmute. So Melissa, you have the floor.
Hi, I have a baby in my hands.
Oh.
I do not have a prepared document, comment. It seems that the majority of the CAG has begun their work on the health study with a sense of distrust, and nothing that has happened so far in their work with the health study has done anything to alleviate that distrust. Every path to trust they've laid down and requested the Department of Public Health to answer has not been answered. And so they haven't gone any farther, and they're, so the lack of no confidence is fairly unanimous. To look at the document, it seems great. I mean, it really seems great, but on paper, it doesn't seem to really come to pass the way it looks on paper from our experience. So I'm cautiously optimistic. I still hope the health study goes forward. I hope it has participation. I hope it's not a whitewash of the SoCal gas dealings. I'm really concerned about the chemical list, because this is a fairly unique blend, considering the blowout is a unique situation and the well kill materials, the oil and gas, the oil wells, the old oil wells, and the natural gas all combined together to make a very unique brew. And without the knowledge of what that chemical list actually is, I don't see the health study being of the great, it could be of great value with the list, and without it, it's always going to be in question. That's it. Thank you.
Thank you. Thank you, Melissa. Dawn, I know that we're putting you on the spot here. You're new, but I'm sure you've been following along on this process. So I just clicked on ask you to unmute. So if you, there we go.
Okay, you hear me all right?
Yes.
All right. I'm quite new with the CAG, just joined the last couple of weeks, and in a way, I sort of feel like I'm been drinking from a fire hose. But I've gotten to know my fellow CAG members and the people that have been here for quite a while, and many of them who are personally, involved and through their loved ones for the things that have happened to them. And I think that they really deserve from the Department of Public Health as much help and openness and honesty that you can possibly give them. So I look forward to a much improved relationship between the DPH and the CAG. Thank you.
Thank you, Dawn. So I'll up that. I think we heard something from each of the CAG members. So if there's any, if you'd like to add any additional comments or post some questions, otherwise we can move into the Q&A and allow for additional questions. And we have some members of the public that have hands raised as well, but want to make sure that the CAG has had ample time to provide input, questions, comments. Brian?
Susan, you're asking for comments on the goals and priorities, and you have ignored the fact that I just requested that the goals and priorities have a patient-centric, long-range clinical study included in it, and it does not. The answer that DPH is probably going to give us is that they're not precluding it, but it is not being required. And without it being required, you aren't really doing a study. And I take offense to the fact that you're asking for it and you haven't, and you're implying that you haven't heard anything, yet you did hear something. So I want to make sure that you understand that that's a very, very important part of this study. And if it continues to be ignored, you are only solidifying all of our feelings that this study is a waste of time.
Thanks, Brian. I clearly didn't get your full question, and I thought it was a comment that you would prefer to have that the only piece of the study. I don't know, Christina or Chris Vakulik or Charlene, if you'd like to have any response to that, or, I mean, we certainly are taking note that that's your preference. Chris or Charlene? Dr. Davis, is Dr. Davis hoping that's MD is you?
Yes, that's me.
Sorry, I saw MD and I thought maybe that's Dr. Davis. So
I couldn't, unfortunately my computer's not working properly, so I have to use my phone. So appreciate that comment. And this is a broad goals and priorities document. There's a lot more that goes into the question of how different types of studies could be weighted in terms of proposals. But the idea was to have this broad enough to get a wealth of ideas, a wealth of different studies that could be done, but there's still more work to be done. So I don't think that this document, again, doesn't preclude it, as you said, it doesn't, but this is not the document that is requesting the researchers and the proposals, and does not talk about scoring of proposals in terms of priorities. I think there's more to come in terms of that, but this is in general. The idea of where the goals and priorities are, they're pretty broad, which does allow for a lot of different things as a possibility. So we will have more updates as we get closer to having this finalized in terms of what people's opinions are in relationship to the goals and priorities. But this document is the document that gives everybody a chance to provide input, and so we take that input wholeheartedly.
Doctor, if I may respond, I appreciate what you're saying, but it is and don't take this personally, please. It is
I never do.
A cop-out, because broad is good. I agree with that, but broad is not the definition of what's being done here. If you do not require a patient-centric long-term study, then it can be that it doesn't happen. And being broad doesn't mean eliminating one of the most important things that you can possibly do. It is the item that should be done. And I can't imagine a health department, and you've heard me say these things before, that is supposed to be concerned about the health of the public, doesn't take the position immediately of, I want to know what's happening to my people. And this document does not do that. It does not put the emphasis on making sure that we understand and find the answers to the problems that the public may be subject to. And I apologize if that's too harsh, but I really am concerned about the people.
Thanks, Brian. I see Patty has her hand up, and then Craig or Dr. Davis, did you want to respond first? Or Patty?
Hey, I just want to piggyback on what Brian said, that our concerns, the community concerns and the CAG concerns are not being alleviated because it is so broad. It doesn't say that the number one goal is to study our bodies, because without studying our bodies, it's a risk assessment and not a proper health study. That is should be the number one thing that is being sent to these researchers. Can you study the bodies of these people who have gone through such harm? And without that, don't call it a health study, call it a risk assessment, and don't take the $25 million. Thank you.
Patty. Craig?
Yeah, just piggybacking on that as well. We have made it abundantly clear as the community that, and we get our input from the community, that the driver of the health study must be looking at the patients, or else it can't be a gold standard study. Plus, you don't know what chemicals they were exposed to, so you have to look at the people. And then throughout the document, it talks about the use of proxies, the use of estimates of exposure. Now, that is really a bad idea, because more actual data is available if DPH and the county had the will to go subpoena this information. You guys have denied this, you have avoided this, and you've never given this community a straight answer. Why should we have faith in a study that's going to guesstimate exposures when the real information is available if you just simply exercise subpoena? And the last thing I want to make absolutely clear to the community, and why there is such a continued distrust, is Dr. Davis, you described that the thing could evolve and put in the RFP in a different way. I want the community to understand, we will never see the RFP in this development. We may see it once it's out and done and it's out there, and we will have no other influence of other than its goals and priorities. And the DPH has chosen not to make the clinical examination the centerpiece of the entire health study. So therefore, it just confirms our suspicions of the path that you're on, and it's about an air quality assessment, and we have no confidence in the path you're on. Thank you.
So just a note.
So that's, hold on.
Go ahead.
Hold on.
Sorry.
So sorry. So that's not what it does in terms of a risk assessment. It talks about the health impacts in relationship to it. We've been completely honest with you. You keep hold on, Craig.
Yeah, go ahead. Sorry.
We've been completely honest with you. You guys talk about you guys have the subpoena power, and I'm saying we don't. We don't get to operate independently. We don't get to do that. And at the same time, you guys have said to us, we don't trust you to do the study. These goals and priorities come from information based on what's come from the community and the scientific oversight committee that is part of the consent decree to determine the goals and priorities. So this is not something that we've done in this regard. You guys have an opportunity, and you're doing it now. I encourage you to put those same comments inside of the posted on the online form or in the email, etc. And we'll get that from everybody in terms of community input. That's why this document is before you. I hear your comments in terms of things right now, but I also encourage you to put those in writing as well. And anybody else that is interested in looking at this or is going to be impacted by this or was impacted in the disaster itself. That's what this period is for you guys to provide those public comments.
And I just wanted to reiterate that too. We are still in the first week, less than the first week into this review. Clearly, the comments in the chat, comments from the CAG have indicated that proxies are not preferred, that you want real estimates of exposure, and that the patient-centered focus aspects of this document are not strong enough. And we're hearing that from a lot of folks in the chat as well as you directly. So those are two key comments that certainly are getting recorded along with your other comments. So just to reiterate what Dr. Davis said, this is the initial phase. This is what this is all about, is getting this feedback. And this, again, we're only a handful of days into this, so we anticipate getting quite a bit of feedback and being able to share that with you, as well as all of that feedback gets shared with the SOC so that they can see what the community is saying about the goals and priorities and making sure that their fingerprint is on that.
Susan, just one comment.
Yes, so Moran, and then I see Craig has his hand up after you. So
one more thing, that cancer has been a poison in this gas blow. Family members passed away. Family members, they went through a very heavy treatment and chemotherapy. Mm-hmm. And I just want to tell you, where is the cancer study is standing? Why we can't get a copy about it? Where is the outcome of it? A cancer study is critical for not me, but for everyone in this community.
Let me get you an update on that in just a second. First, I just want to hear if Craig's comment is related to that, or if, Craig, did you have a different comment? I'll give.
Yeah, thank you, Susan, for unmuting me. It was to Dr. Davis. It is. I've checked with a couple of attorneys. DPH has clear authority to subpoena. It's the one group that has the most authority because of public health concerns. And the other comment, Dr. Davis, about this is your time. Via the survey, for the way to respond via the survey, we will never see, you guys aren't being transparent. We will not see what the community's responses are. So whether you do it or don't, we don't know what you do with those comments. We don't know how you pull them together and advise the SOC. It is a complete black hole. And that's not the transparency we asked for from day one. That's it.
Thanks. And Chris, is there or Dr. Davis, is there an update to provide on the cancer study that I think Moran is referring to that had been underway or being planned? I'm looking around. Sorry.
I'll have to ask Chris, because I thought the CAG or the community was put in contact with USC, which usually does that, the Cancer Center, which usually does that. And I thought they were working with them in relationship to that, but I could be wrong. So if Chris or staff know where that was, then please correct me if I'm wrong.
This is Chris, and no, you're not wrong. Sorry, just give me a second. I'm hearing an echo.
And Brian, I see your hand. You'll be next after. And Lori, oh, you know what, Chris, while you're looking that up and fixing your audio, Lori hasn't said anything yet, so I do want to unmute Lori here.
Hi. I'm sorry. I hope you're not hearing my phone in the background. The subcommittee that we had going for the cancer research study was disbanded, so that is going nowhere right now.
Thanks, Lori.
Susan, this is Andrew. I don't seem to have an ability to raise my hand, but I'd like to make a comment. It can be after Mary.
Yeah, if you could just hold that till after Brian and Mary, and
sure.
let Chris have a quick response here too.
Susan, I have just two comments.
Okay, hold on one second. Just make sure, Chris, are you ready to respond to that yet or not? Let me just let Chris quickly respond, and Brian, then I'll turn it back over to you. Okay, just so we don't lose that trail. Yes.
Okay, good. Right. So the CAG, so several members of the CAG were put into contact with researchers at USC, the Cancer Surveillance Program, and they do analyses for communities that are concerned about cancer in their area for potential cancer clusters. So this is something that they do on a regular basis. So putting this group in touch with USC was a way for to have this concern addressed by a group who does this routinely, who works with community members on a routine basis about cancer concerns. And through a series of communications, several meetings that public health helped facilitate, USC developed an analysis plan to compare the rates of cancer in the communities surrounding the Aliso Canyon facility with cancer rates in LA County as a whole. So through these conversations and this proposed analysis plan, we kind of came to a standstill in terms of whether we wanted to move forward with this. And when I say we, it's not DPH, it's the community advisory group. There were several, I guess, downsides to the analysis plan that was being proposed. So ultimately, if the CAG, it's up to the CAG whether they want to move forward with this, is what I'm saying. So the analysis plan put together by USC is what they do on a regular basis. This is established protocol for how they study cancer concerns and clusters and elevated rates in communities, so that it's their call in terms of how they do this analysis. It's DPH doesn't have any involvement in how USC does that. So it's really up to this community advisory group whether they want to move forward with USC on this. But otherwise, cancer, has been identified as a high concern, if not the top concern of this community, of community members who have been impacted by this disaster, and that's been included in the goals and priorities document. So, the SOC is aware of this. We're aware of it, and we're hoping that by identifying this, that it can be also included in this health study. So
thanks, Chris.
Yeah.
So we can talk a little bit more about that after we connect. And Brian's waiting first, Andrew, if I could.
No, I know, but there's some clarifications on Chris's statement about the cancer subcommittee that need to be made.
Well, you can make them for sure. You're the third in line, I promise. So I want to kind of try to keep in order. So Brian, you're up.
Andrew, I'll try to make this short. Look, communication is the name of the game here, and communication, if it's honest, it's not good, because Dr. Davis just told us that they don't have subpoena power, and that's okay. If that's true, I don't happen to believe it, but if that's true, I'm sure he believes it. But we don't see the communication out of DPH with regards to pushing for it, asking for it, demanding it, trying to find a way to do it. That doesn't happen. Catherine Barger told us that she agreed, but she didn't do anything, and she hasn't put anything out. What Chris is just saying is that it's up to the CAG. Well, look, when Dr. Davis told us in the last meeting we had that all subcommittees are canceled, that does not give us the statement that, oh, you can go ahead and talk to these people and go and follow through, because that's a subcommittee that was doing that. But it was canceled, summarily canceled, without discussion with us, without any understanding or even an explanation. So these are serious communication problems. And to the person who's receiving that communication, it sounds like, we don't want to talk to you. We don't care what you say. Here's what's going on. It's just like this meeting today. It's called a CAG meeting, but it is a DPH meeting, not a CAG meeting. The CAG members are muted. All right. So I'm really disappointed at the way the communication is coming down. And if there's anything honest about it, we can't see it, or at least I can't see it.
So thanks, Brian. You're right. There's some miscommunication that probably went on there. So Mary, I just clicked on your ask to unmute. There we go.
Yeah, I'm going to read what I put in the chat. And it goes back to the survey question, that there have been surveys created by DPH for Aliso Canyon, and we as CAG have asked for the results of those surveys and have not received the information. We do not have confidence that the survey responses will be disclosed and that there'll be transparency about the respondents to the survey. What if there are less than 25 respondents to the survey on the website? How can that be an adequate representation of the community? There is really no transparency, and this contributes to the community mistrust. And most of us on CAG understand how surveys work. Most of us have administratively constructed them, so we know how they work. And to rely on, to have us, or to be told that we need to rely on this information and trust this is just, again, it contributes to the serious and ongoing mistrust of this whole process. And I'd like to reiterate what Brian said about the committees. The committees have been dismissed, and we vocalized our concerns about the cancers, and the issues with the cancer subcommittee. We understand how the USC cancer studies work, and we vocalized our concern about the fact that it had such a narrow focus and could not give us the information that was important for the community to have. And I will defer to other CAG members about this, but to say that this was all CAG, that we somehow said no to the study or anything like that is really misrepresentational of what the actual issue was. And that is that the USC cancer research could not do the cancer research in the way that it needed to be done for this specific blowout. And they were going to use all of LA County, or at least all of LA City, as the control group. Well, how can that work? So again, we as CAG, most of us understand these kinds of things. Most of us have had administrative experience with really understanding these kinds of things and statistics and et cetera. And it is very, very disappointing to be treated this way by Department of Public Health, that we just need to stand by and trust. We don't trust, because we didn't get the information to be able to trust. And so we repeatedly asked for that information. We are still asking for that information, and we are still not receiving it. So
Thanks, Mary. Andrew, thanks for your patience. You're up.
Yeah, sure. So Mary hit most of the topics regarding the cancers subcommittee. I'll just, if I can put a bow on it, it's quite simply for the public to know that the CAG members we felt it inappropriate and it was unacceptable to use a control group of the entire county, because everyone on this call knows how much oil and gas infrastructure is in the entire county. That was not acceptable. To further that, we asked the USC folks, and Craig, you can just nod your head if I get this right or wrong. Over the course of all the years that they have done studies using the county as the group, they have only found one time an elevated cancer issue in one community. One time only. That is not a logical conclusion, having all this infrastructure here. So I just want to be very clear for the public. We understand the issue. We had very specific, I'll just use them, demands on how the study was going to be done, needed to be done. USC could not deliver, not within their parameters. The only way is for that study to be done and paid for as part of the larger study. And we still, of course, think that is a very critical path that needs to be explored. So that's my comment on the cancer subcommittee. Regarding the GNP in general, trying to be unbiased and just read the goals and priorities sections, I would not pull out of there that this group is looking for a researcher to study the people. That this language in here does not reflect that. That is point blank and period. And it makes me so upset to be, in essence, have this group, the community included, like patted on the head about providing our input and providing our this, providing our that. We have said these things for over a year, and we are still having to say them because they are not being represented in the documents that DPH is providing as they try to move forward. They are our concerns, the community's concerns, the community's input, the community's demands, all the things we kept talking about that you want. They are not reflected in this document. They aren't. And to come back and say, well, we'll take it back and we'll look at it and it's just a draft. My point is this draft is half-assed. because we've been telling you this information for months and months and months. This should have been a lot stronger, in my opinion. And there should have been verbiage that indicated that the number one goal of the community is to have the people studied. That's like the biggest goal by a mile. And that does not come through in this document at all.
So thanks, Andrew. And I do want to just close the loop on the cancer, maybe not close the loop, maybe it's reopening something, but it sounds like there's we're talking about the USC study, of which DPH can't necessarily control, was not going to produce the results that we wanted, but maybe it's reflected enough in this goals and priorities document. Next step is that, I mean,
my understanding, the freebie look at that the CAG guys could do had very specific guardrails, and those guardrails did not provide what the CAG felt was what the community wanted, and that at this point we could not move forward.
Okay.
But a research group could access the cancer registry as part of the larger efforts and be able to take a comparative, a reference group. I'm not using the right word. I apologize.
But an accurate control.
Yeah. Somewhere outside of LA County, away from oil and gas.
Okay. So we want to figure out a way that we can still utilize some of the data and contribute more specifically to this study. Dr. Davis, I see that you unmuted if you wanted to respond.
Yeah. I just want to point out that this whole conversation started with DPH didn't deliver on the cancer study. And in the course of this conversation, we hear that, USC couldn't do what we needed to do. But regardless of that, cancer is in the goals and priorities. But I just want to point out where we started and where we ended up. New to us in terms of understanding that that's not that USC couldn't do it in terms of that. Again, we rely on them to do this. This is what they're paid to do. This is what they normally do. Great to know that this didn't work in terms of what they were proposing to do and how they were going to do the comparison. And you're correct. Cancer is in the goals and priorities, and it could be done much differently by an outside researcher, who could propose something completely different.
Thanks, Dr. Davis. Craig?
Yeah, I'm sorry, there's other people with their hands up, but
I don't see it. It's all public right now, so we wouldn't wait till we get all the committee members, and then we'll turn it over to public comment.
I'll be brief. Yes, USC's hands are tied. So not only did we make that clear, but we also the CAG offered an alternative path, and that has gone nowhere. You simply take the data that's available, and you go through proper channels, and you bring in another researcher to take the data and do the analysis that the community really wants to know. And that's a really simple question. Am I just as safe living next to Aliso Canyon as compared to those communities that are away from gas and oil? It's a question that we all have. That is doable, and we thought we could collaborate with DPH and make that happen. That's what stalled. We gave you guys a path.
So Don, it looks like you might be trying to ask a question or say something. Nope. Okay. Just want to make sure. I saw your box light up a couple times there. So we're moving.
The last thing I want to say is I put in the chat, we did a whole CAG did a very detailed discussion on this exact topic. And I put it in the chat, and please go to that link. It's a 20-minute video on this exact issue.
Thank you very much. We have a number of community members who've had their hands raised for a while, but we are moving right at to 5:30, which is more the open Q&A. We started kind of this, I think this cancer study was part of a different question than just the goals and priorities document. So I think we've kind of moved a little bit in that direction, but want to see if there's an opportunity, or want to see if the CAG members have any additional questions you would like to pose, and make sure that we have adequate time for all our community members as well. So we'll launch into just a little bit of open Q&A. If there are questions that you would like a response to, or, oh, Dr. Davis, sorry, I just see you have your hand up.
Sorry, I just wanted to go back to what Craig said. Craig, I appreciate what you're saying, and at the same time, we get that we're not trusted, and we have done our best to get connected to groups that do it and at the same time include that in the study. So giving us an out and at the same time saying you don't trust us, that doesn't seem like that works very well in terms of us doing something in relationship to that data.
Okay.
That data will be available. Hold on, that data will be available for outside researchers, which we've always said that we wanted to have in this because of these questions about trust and DPH doing the research, which we are not doing. And it is something that can be done in terms of the proposals that could come in. And that's why it's in there as one of the priorities.
So I'll interpret that as the CAG is on their own to do the cancer research study that we think is a good design. That's what I'm hearing.
I don't think that's what he was saying.
Okay, maybe I missed something, but anyway, it would have been great. And
No, that's not what I'm saying, Craig. You do that.
Sorry,
that's not
Craig,
exactly
Craig,
what I
just
said.
a sec. Dr. Davis doesn't have the ability to unmute or mute, so I have to keep getting to him. So go ahead.
Sorry, and I'll stop after this. But no, that's not what I said at all, in any way.
Okay, we could start on this tomorrow if you guys wanted to partner up and do the research that the CAG has advocated for. We could start on it tomorrow. But our group was disbanded, so it's very confusing.
So let's table this for now, because we clearly don't have a good answer, but it's something we need to circle back with and perhaps have some more written communication regarding this amongst the CAG and DPH as well. I would just want to again open for any broad Q&A before we turn it over to hear from all of the public that are here as well. I say broad Q&A, I mean open Q&A, other questions that you would like to pose that we may or may not have full answers for right now, but I want to give you the option to do that.
Are you asking the CAG?
Yes, asking the CAG, and then I'm going to open it up for public comment.
I would just say DPH has the list with the graph of every item we've asked for and every open item that still exists. And you don't need to ask us for what other questions we have. Okay. We want what we have spent the last 19 months asking for.
So I'm gonna record that, Andrew, as the we'd like responses to the list or the list of outstanding items that you have shared.
We have asked hundreds of questions and get very little answers. I mean, it's to ask again it's very frustrating because we ask and days, weeks, and months go by and no one gives us a real answer. That's partly why we are here where we are.
If there aren't any specific questions, then I will go ahead and open up. We've got quite a few public members that have been had their hands up for quite a while, so I appreciate all your patience. Julie Kornstein, we'll start with you. I know your hand's been up for quite a while. And Julie, I need to go unmute you. There, you should be able to unmute yourself now.
Okay, now am I unmuted?
Yes, you're good.
Okay, thank you. I don't even know where to begin because it's very frustrating. I just wanted to make it very clear. I am not a member of CAG, but I am a community member, have lived here for over 40 years. You know, when we bought the house, I had no idea that the gas company was even there. None whatsoever. When we went through the Northridge earthquake and several major fires and I was evacuated, I didn't know they were there. And it was a massive shock to me when there was the methane explosion. This is almost 6 years later that we're talking about this. I believe you said that this was the largest blowout in the history of the United States. So to me, this appears to be an emergency that we, the community, know not only what happened, what we breathed in, and what is the impact? How did you say that this report will take 3 years to complete? Can that be answered, please? And then I'll go on with my other questions.
Sure, if you could just, I'll have somebody respond to the question after you're done.
You want me to go through all my questions first?
Well, you have 90 seconds because we really have 2 minutes. We have to get through.
Fast.
Okay, thank you.
I was on the Board of Education for 22 years. I know all about bureaucracies and how long things take. But when it's a health emergency like what we went through, it needs to happen much more quickly. I was totally unclear why this was called a CAG meeting. One of the CAG members mentioned this because it wasn't their meeting. And I think that that's really not a fair thing to call it a CAG meeting. All right, once the report is completed, I hope it's not 3 years, but that's what I thought I heard. What happens next? You will bring forward the information. If it tells the truth, it's probably going to be riveting to all of us living here. Is there going to be any restrictions made on the gas company? Do we just go on living our merry little lives here, waiting for something else to happen? What is the purpose of the study?
Thank you, Julie. If you could, if I could just, I wrote those questions down. I'm going to try to hear from as many people as we can.
I will, let me complete it then. I want to know who has subpoena power. I thought the health department did, but that was not answered. You know, we need to know in this community how we can protect ourselves in the future, because the odds are something will happen again, even if it's in small amounts. You know, I feel like this study is kind of like if I were going to college getting a master's degree, that this would be kind of a community research study. This is our lives right now. We need to know. All right, I'll stop.
Thank you, Julie. I'm going to go to JM Productions. I'm not JMT Productions.
Oh, yeah. Can you hear me okay? Oh.
You should be able to unmute.
Oh, yeah. Can you hear me okay?
Yes, I can hear you.
Yeah, I just can't change my name.
You have about 2 minutes.
Yes, okay. Yeah, hey, my name is John Tebow. I'm a victim of the Aliso Canyon gas blowout that exposed myself and my loved ones to numerous toxins, including potential radiation. It is my opinion that the Department of Public Health acted with willful negligence, further damaging our health by failing to properly investigate the fingerprinting of the toxic crude oil that this community had been inhaling for the 4.5 months. Therefore, I have no confidence in DPH's current health study path, nor in the goals and priorities document. Can you explain why the fingerprinting of the toxic crude oil that the community inhaled for the 4.5 months was never investigated? Thank you. That's my question.
John. Thank you, John. And again, I'm collecting the questions, and we'll get through as many answers as we can. I just want to make sure we get all the comments and questions. Nancy Hernandez, I'm going to go to you next. So Nancy, if you...
Hi, can you hear me?
Yes.
Perfect. My name is Nancy Hernandez. I am a victim of the Aliso Canyon gas blowout that exposed my loved ones and me to numerous toxins, including potential radiation. It is my opinion that the Department of Public Health acted with willful negligence, further damaging our health by failing to properly investigate my son's objective laboratory findings presented to the pediatric toxicologist at LA County Department of Public Health. That not only was dismissed, but he scoffed at the results. Supervisor Catherine Barger's further willful negligence was demonstrated by her lack of producing the chemical list that was promised by her in a face-to-face meeting held 1 year ago with the Aliso Moms Alliance. Therefore, I have no confidence in Department of Public Health's current health study path, nor in the goals and priorities document. Thank you.
Thanks, Nancy. Deirdre? You're on.
Okay. Hello. My name is Deirdre Bologna, and I am also a victim of the Aliso Canyon gas blowout that exposed me and my loved ones to numerous toxins, including potential radiation and oil particulate matter that now live forever in my lungs. It is my opinion that the Department of Public Health acted with willful negligence, further damaging our health by actually refusing to properly investigate any of the many concerns of our community, and most shockingly, not fighting for the SoCal gas chemical list. I'm in agreement with all that has been stated by my fellow community members. Therefore, I have no confidence in Department of Public Health's current health study path, nor the goals and priority document. And
Thanks, Deirdre.
Thank you.
Helen. I'm going to unmute Helen. Great, Helen, you have 2 minutes.
Okay. Can you hear me?
Yes, we can hear you.
Okay. My name is Helen Atai. I'm a victim of the Aliso Canyon gas blowout that exposed my loved ones and me to numerous toxins, including potential radiation. It is my opinion that the Department of Health acted with willful negligence, further damaging our health by failing to properly investigate the testing of toxin as blatantly opposed by Dr. Rangan in a documented letter sent to our community's healthcare providers. Therefore, I have no confidence in DPH's current health study path, nor in goals and priority documents. Thank you.
Thank you, Helen. Gary Fordyce, if I'm saying that right.
Yes, thank you. 5 years in, DPH has essentially executed a military evasive tactical maneuver. Reference has been made to a brew. Well, there's a strong belief that this is an extremely toxic brew. This dance that DPH representatives put on with such politeness and such cordialness and politeness and so on is tiring. And
Gary, I think we lost you. I'm gonna go ahead and mute Gary. If you can come back in, just raise your hand again and I'll call on you.
Their issues treated.
Gary, you're cutting in and out, so I'm gonna have you come back in if you can. Sherry, I'm gonna go to Sherry.
Yes, this is Sherry Darrohanian. I wanted to know about that document that you're interested in having people public comment on. I was under the understanding that there was a survey that was, the survey was extended because the original survey only had 8% of Porter Ranch Ground Zero residents responding to the survey, and 8% of the people that live within a 2-mile radius of the facility is very inadequate and improper. So you guys opened it up for another 30 days, I believe in November of 2020. It's now 4 months since November. And I don't see how, if you don't have the results and share the results of the revised survey results that include more Porter Ranch people, more than 8%, because they were the ground zero people that experienced the worst of the Aliso blowout. So if you're not taking those results and incorporating them into your document that you want us to comment on, I don't understand how this works. It's not very transparent, number one, and I don't see how people would comment on it if we don't know if that stuff is incorporated into your document. So thank you.
Thanks, Sherry, and we'll respond to that in just a minute as well. I think Jane Fowler, you're next.
Hi, my name is Jane Fowler, and I am a victim of the Aliso Canyon gas blowout that exposed myself and my loved ones to numerous toxins, including potential radiation. It is my opinion that the Department of Public Health acted with willful negligence, further damaging our health by failing to properly investigate. And my fellow community members have brought up everything I wanted to bring up, and I am in agreement with all that has been stated by my fellow community members. Therefore, I have no confidence in Department of Public Health's current health study path, nor in the goals and priority document. Thank you.
Thanks, Jane. I see Heidi, you're up next. And then Gary, I see you're back and I'll call on you in just a second. So Heidi, I think it's Heidi. I know
Yes,
you mentioned.
can you hear me?
Yes, yes.
Hi. Good afternoon. My name is Heidi Tortorici, and I'm a victim of the Aliso Canyon gas blowout that exposed me and my loved ones to numerous toxins, including potential radiation. It is my opinion that the Department of Public Health acted with willful negligence, further damaging our health by failing to properly disclose the pertinent health information in direct violation to their goal statement as a public health agency. Therefore, I have no confidence in Department of Public Health's current health study path, nor in the goals and priority document. Thank you.
Great. And Gary, I see that you're back, so I'm going to unmute you and hopefully you have a better connection.
Can you hear me clearly?
Yes, we can hear you.
Thank you. 5 years in, and DPH actions have been tantamount to a military evasive tactical maneuver after maneuver. Much reference has been made to a brew. Well, it is strongly believed that this is a very toxic brew, and the dance that is being put on by DPH representatives, also polite and cordial and very evasive, is not inspiring any confidence whatsoever. And so the question is, when are you going to stop this and start caring about human quality of life, human health, and life itself? People need to have information to go to their doctors. Bottom line, time is life. Any doctor, any professional nurse will tell you that. Time is life. Stalling and stalling is going to cost life, and you need to get this information into the hands of those who need it. Thank you very much.
Thank you, Gary. So just want to respond to a few of the questions. A lot of the public statements were statements, and we certainly will collect all those, and those will go into the record here. But there was a question Sherry had asked about the survey. And just to clarify, Sherry, I know you weren't on in the very beginning of the meeting, but there was some clarification on that survey. Those results will be coming out this Thursday. They have been documented. It was just getting them in a format to be able to share them publicly. They've been shared with the CAG subcommittee for review, and then they'll be going out more broadly. So they have influenced that document that you're referring to, the goals and priorities document. So that has been a part of the reference, and we encourage you to take a look at those survey results and compare and ensure that you feel that they meet it meets those results as well. There was also a question about the length of the study, and I'm going to ask Chris to maybe respond to that about the length of the study, as well as kind of what the expected outcomes could be. I know we don't really know that at this point because it depends on what research is conducted, but maybe Chris, if you could respond as well as you can to that, and if Dr. Davis or Charlene or anyone wants to add to that, it'd be great.
Sure, yeah, can you hear me?
Yes.
Okay, great. So the 3 years that I mentioned before, the study, it really depends on the type of research that's conducted, the study itself. So the study will likely be composed of more than one project, so different research and research. So after 3 years, it's likely that the research could last more than 3 years or less than 3 years. It just really depends on the actual research itself. But at the 3-year mark, the Scientific Oversight Committee is going to evaluate the research up to that point and see if it is actually on track to meeting the goals that they outlined for this health study. So that was the significance of the 3 years, and that evaluation will happen on an annual basis after that 3-year point. In terms of your second question about the purpose and what this can accomplish, so going back to the goals, the whole purpose or goal of this is to increase the understanding of what the short and long-term health impacts could be as a result of this disaster. So the research will, the findings of the research will likely be put into a report, and then that information will be made available to the public. And whether that informs, for example, public agencies or individuals or maybe even public actors, it's really up to how that information is used once it's made available.
Thanks,
I don't know
Chris.
if maybe anyone else from DPH has anything to add to that, but
Dr. Davis.
Yeah, the 3 years is really that's a point that's spelled out in the consent decree in terms of reevaluating the progress on the study and whether or not it continues to move forward based on that. But in between that time, there will be check-ins, with the researchers and if need be, assistance and problem solving, which I think most of them will be able to do on their own as they're doing their research. But it's not as if, it gets funded and it just goes 3 years or whatever that time period is without any, look or updates in terms of progress on the study by the Scientific Oversight Committee.
Great, thanks, Dr. Davis. And I do have a note that Dr. Nordella would like to ask a question, but is unable to raise his hand. So Dr. Nordella, I will unmute you now, or you will unmute yourself now that I've asked you to unmute. There we go. And you have 2 minutes. Thanks.
Wow, a little difficult to get it all in 2 minutes since it's been 5.5 years. There are numerous questions, but I think that you can see by the response to the community that the Department of Public Health, in my opinion, has aided and abetted the Southern California Gas Company, being that they have dumped the toxins onto the community. There's never been a proper investigation. And I think that we have obviously a plethora of evidence that that has occurred. Now, I apologize, I kind of came in late and I heard Dr. Davis mention something that, DPH had not lied to the community. And I would just ask him, and again, I'm not sure why there's so much rotation of personnel within DPH, from Angelo Belomo to Cyrus Rangan to Gusenheiser to Paul Simon, everybody's gone. But the point being is that I think that you might want to take 5 minutes, if you haven't, and look at the information that's documented on your letterhead by the Department of Public Health that basically lied to the community and told them that you knew nothing about toxic crude oil that was being screened. Now, this is not a personal issue to you because you were not here at that time. But yet there's documentation from Cynthia Harding that states that you were aware of this in December of 2015, and you negligently did not act upon it by just asking the community to strap on a P100 mask. And it's so ironic that we're here fighting COVID with all of the mask issues. You also, and I have documents of admission that you lied to the community when you told them that you tested for benzene on the countertops. And then in a reply to an article, you now admitted that you did no testing of the benzene on the countertops. And you told them also that the benzene in the canisters were normal, and they were not. And I mean, we can go on and on, but I'm limited to 2 minutes. But maybe you could just address those points and let the community know why you are aiding and abetting Southern California Gas. Last point is that if you are sitting in a chair, and I do not know your title, and you claim that you have no idea about subpoena power, unless you've made it clear that you've actually investigated and you don't have subpoena power, I would suggest you go back to your office, pick up the phone, maybe talk to Peter Lee, counsel for the county, and ask them, do we or do we not have subpoena power? This community has been asking for you to address that question, Department of Public Health, not necessarily you, but Department of Public Health, for I don't know how many months. And you and Catherine Barger and everybody just throws their hands up and say, well, gosh, I don't know if we have subpoena power. It's just a little bit of due diligence and investigation. Contact your in-house counsel and ask them if that exists. And if it does, you should be acting on it. Because if not, that's exactly fulfills willful negligence definition. Thank you.
So, and Dr. Davis, would you like to?
Sure. So one comment's taken out of context. I wasn't here during the blowout nor the response. I was speaking about, in terms of talking about what we've done thus far in terms of talking about subpoena power. What I said about subpoena power is that we don't have independent authority to do that. So we will go back as you guys have noted in terms of talking with counsel as well as with the supervisor's office to figure out, what, if anything, is the move forward in terms of things. But it's not something that we have the ability to do independently. So really clear about that. And again, taken out of context. And again, I wasn't here during that time.
Thanks, Dr. Davis. So we have about 5 minutes left. Just to note, I believe it was overwhelming in the chat responses that 6 o'clock p.m. Well, I don't know if we had everybody respond, but I think we had at least 6 of 8. And I don't know if Christine, if you can let me know, Christine, if anyone else responded after the last update I saw, but the future meetings will be 6 to 8 p.m. So we'll update the website to reflect that so that the future quarterly meetings noted for this year will be noted for 6 a.m. It was just pasted into the chat. Also, just a note, just as if you could go back to the slide that has the opportunity to provide input on the goals and priorities document, just a reminder that will be available through April 16th. And we strongly encourage everyone to provide input there on the website. There's a variety of ways, again, to do that. For those that came a little bit late, you can do it through a form, an online form to provide input. You can type it directly into an email. And we're trying to work with potentially neighborhood councils to possibly present there as well, or provide a forum. They may be able to provide a forum, I should say, to collect some input too. So we have about 4 minutes left. Brian, I'll let you have the last word.
Yes, because of all this discussion about subpoena power and Dr. Davis's statement that they don't have independent authority, I think there's a little munching of words there, but regardless, let me make a suggestion. And I won't say that I'm holding my breath for this, but one suggestion that could happen and would make everything feel a little better among everyone, I believe, and I can only speak for myself at the moment, but I would like to have Dr. Davis go to his council, the county council, and set up a meeting between the county council, DPH, and the CAG. And I am asking on this on the basis of the fact that we are a branch of DPH because they established us. Therefore, there should be no reason why county council could not meet with the CAG and explain to us what is going on with subpoena power from their standpoint. I think that would be a reasonable request, and I would hope that it could happen.
Thanks, Brian. So just to reiterate, the opportunities are there to provide input. We will definitely be providing additional written updates on the website and notices for additional information between now and the next CAG meeting as well. And be sure to keep the lookout for a summary of the input after the period closes as well. With
Susan,
that,
I apologize, I can't raise my hand.
Andrew.
I just want to point out the CAG website, the CAG page on the county's website hasn't had a meeting update since I think last July.
It's very close. And it's more, I see Patty, you're shaking your head. I mean, it's very close to being updated. They're all in a queue to be updated, and hopefully will be updated by this week. So
that is ridiculous that we're like 9 months without a meeting update. Like,
I don't know if it's quite 9, but yes, you're right there. It's inadequate, and those will be fixed hopefully as by next week. I mean, I can't promise that because we've tried promising before and that sometimes things happen, but that's definitely one of the priorities in the queue right now, especially now that the goals and priorities document is up and live. Those kind of loose ends will all be figured out. But I don't want to end on a bad note, so I want to thank everybody for your participation this evening.
Susan,
this
Dr. Rodella
afternoon.
did have a follow-up and he's unable to raise his hand.
Well, if you could type it into the chat, that would be great because, right, I mean, we have not even 1 minute left in the meeting and
We can't extend 3 minutes. I'm sure the CAG wouldn't mind.
I'm going to have to say we're going to close the meeting because if we don't, we're just going to have to keep having everybody else that wants to add another comment. So Dr. Nadell, if you could please just respond to, in writing, and I really don't want to have a tit for tat going back and forth between Dr. Nadella and Dr. Davis. It's not productive. It's not helpful to the study. The back and forth isn't really going to help anyone's health right now. So I think that's probably not conducive for the end of this meeting. But thank you, everybody, and look forward to everybody's continued participation. Thank you.